Stop for a moment and listen closely, because if your blood sugar has been creeping higher, even though you're doing everything you were told to do, what you're about to hear may either make you angry or finally bring relief. For decades, I've watched people follow the rules perfectly. They take their medications on time, they avoid the foods they were warned about, they try harder every year. And yet their numbers still rise, slowly at first, then all at once. When that happens, they're usually told the same thing again and again: restrict more, increase the dose, accept that this is just how it goes with age. But that explanation leaves out something fundamental. Here's the truth that rarely gets said out loud. In most cases, the problem is not that glucose is entering your blood. The problem is that glucose can't get into your cells. And one of the most common, most overlooked reasons for that has nothing to do with food, sugar, or willpower. It has to do with hydration at the cellular level. There is an extremely high chance that your cells are resisting insulin not because of what you ate yesterday, but because they are not properly hydrated today. This isn't a fringe idea, it's basic human physiology. Yet it's been pushed aside for years because it doesn't fit neatly into a prescription pad or a procedure code. There is no drug that fixes this. There is no surgery. And because of that, it rarely becomes the focus of treatment. I've seen fasting glucose drop dramatically in a matter of weeks without changing a single meal, without adding a new medication, simply by correcting how and when the body receives water. Not by drinking endlessly, not by chasing thirst, but by restoring the internal environment that allows insulin to do its job in the first place. You are not failing, your body is not broken, and your doctors are not malicious or dishonest. They are working within a system that focuses almost entirely on inputs like food and medication, while largely ignoring the condition of the cells those inputs are supposed to reach. Once you understand that distinction, the confusion and frustration you've been carrying for years often begin to ease. Blood sugar rises for two main reasons. One is obvious: glucose enters the bloodstream from food or from the liver. The other is less discussed, but just as important. Glucose stays in the bloodstream because it cannot move into the cells. Insulin is the messenger that tells cells to open and receive glucose, but that message only works if the cell membrane is flexible, responsive, and properly hydrated. When cells are even mildly dehydrated, their membranes become more rigid. That rigidity makes them resistant. Insulin can be present in normal or even high amounts, but the signal doesn't land the way it should. Glucose remains circulating, numbers rise, and the assumption becomes that the disease is worsening. In reality, the environment inside the body has shifted in a way that makes normal physiology harder to carry out. This is why two people can eat the same meal and see completely different blood sugar responses. It's why the same person can eat the same breakfast on two different mornings and get two wildly different readings. The variable isn't always the food. Very often it's the state of hydration inside the cells at that moment. As we age, this issue becomes more pronounced. Most adults over 65 are chronically underhydrated, even if they drink fluids regularly and rarely feel thirsty. This is not an opinion. It's measurable and well documented. Yet it's almost never treated as a core issue in blood sugar management. There are several reasons for this. One is that the body's internal water channels, called aquaporins, become less responsive with age. These channels are responsible for moving water into cells. When they slow down, drinking water doesn't automatically translate into cellular hydration. Another factor is kidney efficiency. Aging kidneys are less able to conserve water, which means more fluid is lost through urine. At the same time, the sensation of thirst becomes weaker and delayed. By the time thirst is noticeable, dehydration has often been present for hours. On top of that, many common medications used for blood pressure, heart conditions, and diabetes increase fluid loss as part of how they work. The result is a perfect storm. You can be significantly dehydrated without feeling it, without having a dry mouth, without any obvious warning signs, while your blood sugar quietly becomes harder and harder to control. When dehydration is present, blood becomes thicker and circulation slows. Insulin has a harder time reaching peripheral tissues. Stress hormones rise because dehydration is perceived by the body as a threat. Those stress hormones signal the liver to release more glucose into the bloodstream. At the same time, the cells are less able to accept that glucose. The outcome looks like worsening diabetes, but the driver is often dehydration. To make this more concrete, consider a common scenario. Someone's fasting glucose has been stable for years, hovering in a predictable range. Then, seemingly out of nowhere, it starts climbing. No major diet changes, no missed medications, no clear explanation. The conclusion is usually that the condition is progressing. But when hydration is examined carefully, it often turns out that water intake has gradually declined, especially plain water. Coffee, tea, diet soda, and juice have replaced it. The body has been running on less and less cellular water, and eventually insulin resistance becomes unavoidable. When hydration is corrected in a structured way, the change can be striking. Not because anything magical was added, but because something essential was restored. The same food produces a different response. The same medication suddenly works better. Morning readings stabilize. The body stops fighting itself. This leads to an important reframing. Blood sugar instability is very often a volume problem, not a discipline problem. It's not about trying harder, it's about making sure the cells are physically capable of responding. You can do everything right on paper and still struggle if that foundation is missing. Most people are never taught how hydration actually works inside the body. They're told to drink more water if they're thirsty. They're told that 8 glasses a day is a good rule of thumb. But those ideas don't account for timing, temperature, mineral balance, or age-related changes in physiology. And those details matter far more than most realize. One of the most common mistakes is counting coffee, sweetened beverages, or even juice as hydration. These fluids have effects, but they don't hydrate cells in the same way. Coffee and many teas increase fluid loss. Juice adds glucose to the bloodstream. Diet drinks can interfere with insulin sensitivity over time. None of these replace plain water when it comes to cellular hydration. Another mistake is drinking water ice cold, especially first thing in the morning. Cold water causes blood vessels to constrict. That reduces circulation temporarily and slows the delivery of insulin and glucose to cells. In the morning, when the body is already dealing with hormonal shifts that raise blood sugar, cold water can actually make readings worse rather than better. A third mistake is waiting until thirst appears and then drinking large amounts at once. Thirst is a late signal, especially after 60. By the time it shows up, cells have already been dehydrated long enough to affect insulin response. Drinking large volumes at that point often leads to frequent urination without adequate cellular absorption. These patterns are incredibly common, and they quietly undermine blood sugar control day after day. The good news is that they are fixable, and the fix doesn't require deprivation or complexity. It requires structure. The body responds best to hydration when water quality, timing, and regulation are aligned with physiology. Plain, clean water works. Minerals matter because water needs electrolytes to move into and stay inside cells. Timing matters because hydration at certain moments has a disproportionate effect on insulin sensitivity and stress hormones. When hydration is structured properly, several things happen at once. Blood becomes less viscous and flows more easily. Insulin reaches target tissues more efficiently. Stress hormones decrease. Glucose absorption from meals becomes smoother rather than spiky. Overnight dehydration is corrected earlier in the day, reducing exaggerated morning readings. This is not about replacing medical treatment, it's about supporting it. Medication, nutrition, and movement all work better when the internal environment is right. Without that environment, they struggle, no matter how perfectly they're followed. In the next part, we'll go deeper into how age changes hydration needs, why timing often matters more than total volume, and how a simple, realistic structure can be implemented without disrupting daily life. Once you see how these pieces fit together, blood sugar patterns that once felt random start to make sense, and control feels possible again. Let's continue because understanding why hydration matters after 60 is critical. As we age, several changes make it much harder for the body to maintain proper fluid balance. First, the aquaporin channels in our cells slow down. These are the tiny gatekeepers that allow water to flow into cells efficiently. When they don't work as well, it doesn't matter how much water you drink. It may never fully reach where it's needed. Second, kidney filtration efficiency declines. Aging kidneys can't conserve water as well as they used to, so fluids are lost more easily. Third, thirst signals weaken. By the time you feel thirsty, your cells are already dehydrated. And fourth, medications that are commonly prescribed for blood pressure, heart conditions, or diabetes pull water from the body as part of their mechanism. Combine all of this, and you could be profoundly dehydrated without even realizing it. Even mild dehydration changes how cells behave. Rigid, water-depleted cells resist insulin. It's not that the medication isn't working, it's that the cells can't receive glucose efficiently. Insulin is like a key, and when the cells are dehydrated, the lock stiffens. Glucose stays in the bloodstream, numbers rise. And it looks like the disease is progressing when really it's a solvable environmental problem. I want to give you a clear example. Mark, 72, had his fasting glucose stable in the 120s for years. Suddenly it jumped into the 180s. Nothing changed with his diet, exercise, or medication. When we looked at his daily routine, he was drinking fewer than 2 glasses of plain water each day. Most of his fluids came from coffee and juice. We implemented a simple structured hydration strategy. No diet changes, no medication adjustments, just timing, temperature, and minerals. Within 2 weeks, his fasting readings dropped dramatically. Same food, same meds, different hydration strategy. That's the power of correcting the right variable. The core insight is this. Blood sugar instability is often a volume problem, not a food problem. When cells are hydrated, insulin works. When they aren't, everything else becomes secondary. Proper hydration is the foundation that allows all other strategies, medications, diet, and exercise to work as intended. To make it actionable, I developed what I call the WTR protocol. W is for water quality, T for timing, and R for regulation and adaptation. First, water quality. Filtered water is ideal, but clean tap water is acceptable. Minerals matter, especially magnesium, potassium, and sodium, because glucose transport depends on electrical signaling. Trace mineral additions, even just a pinch of sea salt or a few drops of mineral solution, improve cellular hydration significantly. Timing is where most people fail. It's not about drinking large amounts randomly, it's about strategically hydrating at the moments that matter most. There are 4 windows. First, immediately upon waking, room temperature water, 12 to 16 ounces. This helps correct overnight dehydration, reduces cortisol-driven glucose release, and primes cells for insulin sensitivity. Second, 30 minutes before meals, 8 to 12 ounces. This improves blood flow to the digestive system and smooths out glucose spikes. Third, mid-morning and mid-afternoon, 8 ounces each. This maintains hydration throughout the day, preventing gradual insulin resistance. Fourth, 2 to 3 hours after your last meal, 8 ounces. This supports kidney function overnight without interfering with sleep. The difference between randomly sipping water and following these windows is dramatic. Here's why timing is so effective. Hydrated blood moves faster and carries insulin more efficiently. Stress hormone levels drop because dehydration is a stressor. Glucose absorption is smoother, leading to smaller post-meal spikes. When cells know they will consistently receive water at the right times, insulin response becomes predictable and glucose readings stabilize. The first week will feel different. You'll urinate more often. That's normal. Your body is recalibrating. This adaptation phase typically lasts 10 to 14 days. By the second week, variability starts to decline. Fasting glucose begins to stabilize. Post-meal spikes shrink. By week 3, the improvement becomes noticeable. Week 4 and beyond, lab measurements, including A1C, start reflecting these improvements. Elaine, 75, had an A1C that climbed from 7.9 to 8.8 over 6 months. Her doctor was considering insulin. She thought she was failing. When we assessed her hydration, she was severely dehydrated. 1 glass of water a day, mostly drinking diet soda and decaf coffee. Implementing structured hydration, minerals added, 4 windows, room temperature water, brought her A1C down to 7.4 in 3 months. No new medications, no extreme diet, simply restoring the environment her body needed to make her existing treatment effective. It's also important to address common myths. First, thirst is not a reliable guide after 60. By the time you feel thirsty, your cells have been dehydrated for hours. Second, drinking water with meals doesn't dilute digestive enzymes in a harmful way. Moderate amounts are fine and can actually slow glucose absorption. Third, hydration from food alone isn't enough. Fruits and vegetables contribute, but plain water is necessary for optimal cellular function. Fourth, 8 glasses a day is not a one-size-fits-all rule. Body size, activity, medications, and climate all affect needs. 4 hydration windows with the right volume matter more than a fixed number of glasses. Seasonal variations also play a role. In winter, indoor heating dries out the air, pulling moisture from your body. Dehydration is less visible because you're not sweating, but blood sugar responds just the same. In summer, sweating increases fluid and electrolyte loss, making minerals even more critical. Without them, water passes through the body without adequately hydrating cells. Timing also affects sleep. Drinking a liter of water before bed may seem helpful, but it can disrupt sleep, leading to elevated cortisol and higher morning glucose. Spacing fluids across the day and reducing evening intake allows better overnight rest and more predictable fasting readings. Medication interactions must be considered. Diuretics pull water from the body. When starting structured hydration, spacing intake properly is key. Drinking large amounts immediately after a diuretic is counterproductive. The water passes through too quickly. Sip consistently throughout the day to allow proper absorption. Some patients even need dose adjustments under medical supervision as their hydration and blood pressure improve naturally. Coffee is another factor. It's a diuretic. For every cup consumed, an extra 8 ounces of water is required to compensate. Coffee is not counted toward your hydration windows. Water is water. Coffee is coffee. Both have a role, but they are not interchangeable. Early in my career, I didn't pay much attention to hydration. I focused on surgical technique, medications, and diagnostics. Over time, I noticed the pattern. Patients who hydrated well recovered faster, had better wound healing, more stable blood pressure, and easier blood sugar management. I realized that focusing on the structure while ignoring the foundation was a mistake. Structured hydration became a cornerstone for improving outcomes. Accountability helps. Partners, friends, or family members checking in on each other's hydration makes a difference. Even non-diabetics benefit from better hydration, which strengthens adherence and motivation. It is critical to understand this is not a cure. Medication should never be stopped without medical supervision. If you have kidney disease, heart failure, or take diuretics, consult your physician before making major fluid changes. Overhydration can occur, though rarely, with swelling, sudden weight gain, headaches, or nausea. Adjust gradually and pay attention to your body's signals. Tracking progress visually reinforces motivation. A simple notebook works best. Record the date, each hydration window, and key blood sugar readings. Within 2 weeks, patterns emerge. You'll see how consistency in hydration correlates with improved readings. This visual feedback strengthens adherence and confidence. Complexity is the enemy. Some people overcomplicate hydration, investing in expensive alkaline machines or stressing over precise mineral ratios. Filtered water and a pinch of sea salt are sufficient. Stick to 4 daily windows, keep it simple, and focus on consistency rather than perfection. Troubleshooting after 3 weeks involves checking 5 main factors: water temperature, mineral content, timing adherence, compensation for diuretics or coffee, and sleep quality. If all are correct and improvements are not seen, other variables must be explored with your doctor. The long-term benefits of structured hydration extend beyond blood sugar. Energy stabilizes, mental clarity improves, sleep quality improves, skin becomes more elastic, digestion is smoother, blood pressure stabilizes, kidneys function more efficiently, stress responses decrease. Hydration doesn't just support blood sugar, it enhances overall physiology. This approach also addresses the emotional burden of diabetes. Guilt and frustration often come from unpredictable readings or increasing medication. Structured hydration restores predictability, giving a sense of control and confidence that the body can respond effectively. In the next part, we'll explore practical implementation strategies, step-by-step guidance for building the 4 hydration windows, how to incorporate minerals, temperature considerations throughout the day, and real-life stories of sustained improvements. We'll also discuss how hydration interacts with exercise, travel, seasonal changes, and long-term health, showing you how to transform this simple habit into a lasting foundation. Now let's bring everything together into actionable steps that can transform how your body responds to insulin and stabilize your blood sugar. The key is implementation. Start gradually, build consistency, and let your body adapt. Begin with 1 hydration window. For most people, the easiest starting point is immediately upon waking. Place a glass of room temperature water by your nightstand tonight, add a pinch of sea salt or trace minerals, and drink it first thing in the morning. Do this for 3 days, no rush, no stress, let your body adjust. Once you've established that first window, add the pre-meal hydration window 30 minutes before lunch. 8 to 12 ounces of room temperature water, again with minerals. Maintain that for 3 days before adding the mid-morning and mid-afternoon windows. Finally, add the evening window 2 to 3 hours after your last meal. This gradual layering allows your aquaporins, kidneys, and bladder to adapt, minimizing discomfort and maximizing absorption. Tracking is essential. Use a simple notebook. Write the date, check off each hydration window, and record blood sugar readings. Fasting in the morning, 2 hours after breakfast, and before bed. Within 2 weeks, patterns emerge. You'll see how consistent hydration correlates with more predictable readings. This isn't about perfection, it's about building a routine that the body can rely on. Let's address common questions. What if you forget a window? Don't double up, simply resume at the next scheduled time. Can you drink more than the recommended amounts? Yes, but increase gradually. Sudden large volumes overwhelm the body and reduce absorption. What if you're already drinking plenty of water? Then focus on timing, temperature, and minerals. You may have volume, but your cells might still be dehydrated. Hydration interacts with lifestyle in important ways. Exercise is beneficial, but when done in a dehydrated state, it can paradoxically raise blood sugar because stress hormones increase. Hydrating 30 minutes before activity and again afterward ensures that movement lowers glucose as expected. Travel presents another challenge. Disrupted routines, airplanes, long drives, and hotel stays often lead to dehydration. Bring a reusable water bottle, track your 4 windows, and make hydration portable. Consistency during travel prevents days of elevated blood sugar upon return. The emotional benefits are profound. Structured hydration reduces the feeling of unpredictability, the stress of rising numbers, and the fear that the body is betraying you. Patients report increased confidence, reduced guilt, and a sense of empowerment. They realized they were not failing, their cells were simply missing the basic environment they needed to function. The long-term effects compound. Over months, fasting glucose stabilizes, post-meal spikes shrink, and A1C begins reflecting these improvements. Sleep quality improves, which independently enhances insulin sensitivity. Mental clarity increases. Energy stabilizes. Blood pressure often normalizes, and kidneys filter more efficiently. The benefits ripple throughout the body. Consider the stories of patients I've worked with. Robert, 68, diabetic for 12 years, was frustrated with fasting glucose in the 160s despite medications. Implementing the WTR protocol brought his fasting glucose into the 130s within a month and into the 110s within 3 months. His doctor reduced his medication. Robert cried in the office, relieved to discover he wasn't broken, he was dehydrated. Patricia, 71, experienced unpredictable readings despite years of monitoring. By front-loading water in the morning and afternoon and reducing evening intake, her readings stabilized within 3 weeks. The key takeaway is that structured hydration is not a temporary intervention, it's a permanent foundation. Once your body recalibrates, hydration becomes automatic, much like brushing your teeth. Year 1, your blood sugar stabilizes. Year 2, A1C remains in range without increasing medication. Year 3, medication reduction may be possible under supervision. Year 5, stability persists. This is sustainable health, not a quick fix. Seasonal adjustments matter. In winter, indoor heating dries the air, increasing dehydration risk. Be intentional. In summer, sweating leads to fluid and electrolyte loss. Trace minerals, magnesium, potassium, sodium, help retain water in cells. A pinch of sea salt or a mineral supplement in each glass of water ensures hydration is effective. Water temperature also matters. Morning water should be room temperature or slightly warm. Cold water in the morning triggers stress hormones, raising blood sugar. Later in the day, slightly cool water can support circulation without shocking the system. These small details create cumulative improvements. Hydration also enhances the effectiveness of medications. Take metformin, for example. When cells are dehydrated, the medication cannot distribute efficiently. Adding water 30 minutes before and with the medication allows it to reach the cells, improving efficacy. Patients often see improved readings without changing the dose. The medication didn't change, the body's ability to use it did. Structured hydration also reduces variability in blood sugar. Consistent readings are better than fluctuating ones. Even if your average glucose is high, consistency means your body can adapt. Variability stresses the body. Structured hydration minimizes fluctuations, creating stability that supports metabolic health. Hydration isn't glamorous, but it's essential. It works silently in the background, making everything else, diet, exercise, medication, more effective. Small, consistent actions create measurable improvements. And you're not just managing blood sugar, you're improving sleep, mood, skin, digestion, blood pressure, and kidney function. Now the challenge? Commit to 90 days. Follow the 4 hydration windows, add minerals, maintain room temperature water, and track readings. If after 90 days you see no improvement, reassess with your doctor. In my experience, no one who implements this protocol correctly for 90 days fails to see measurable improvement. This is about building a foundation, not chasing perfection. Practical tips. If you dislike plain water, add a slice of fresh lemon, cucumber, or a sprig of mint. Avoid artificial sweeteners. Set gentle reminders on your phone until the habit becomes automatic. Keep it simple: filtered water, trace minerals, room temperature, structured timing, and a notebook to track progress. Gradual layering prevents overwhelm and ensures long-term adherence. This approach is accessible and cost-effective. Mineral drops cost a few dollars per month. A water filter lasts months. Compared to the costs of medications, doctor visits, or complications, it's minimal. Small investment, huge return. Finally, remember the broader lesson. You stabilize blood sugar by supporting your body, not fighting it. Cellular hydration is the missing piece that allows insulin to work, glucose to enter cells, and your body to regulate naturally. You weren't failing. You were missing the foundation. Once that's restored, everything else works more efficiently. Try this for 2 weeks. 4 hydration windows, room temperature water, trace minerals, and tracking. Keep your diet and medication constant. Watch your fasting glucose, your energy, and your mental clarity. The proof is in the results. Once you see it, you'll know the difference. Your body responds, your confidence returns, your life feels manageable again. This is the power of getting the basics right. Hydration isn't just a habit, it's a foundation for resilience, independence, and lasting health. By supporting your body with structured hydration, you unlock the potential your cells have been waiting for all along. You weren't failing, you were missing one simple critical piece. Now you have it. Take control, start today, and let your body do what it was designed to do.